Now let's look at some CPT examples. So CPT stands for Current Procedural Terminology. It's published and maintained by the American Medical Association. Now this is where we find our services and procedures. Now in this course, you do not have to use a coding resource. Instead, we're going to focus on the Superbill. Now the Superbill is known as an encounter form because it tracks our most common services and procedures that are performed in our office. So let's look at an example of a Superbill. Here is a Superbill that I retrieved from the American Academy of Family Practice's website, which shows a lot of detail of procedures that you will commonly see in this particular setting. And this is a setting we'll focus on for this course because most of us are familiar with a lot of these conditions. So you can see at the top, it has the date of service, the patient demographic information, as well as financial information regarding things such as the balance due and the total charge amount. Now here is what we're going to focus on. So instead of using the CPT manual, you're going to do like we do as well in a clinical setting, is use our Superbill as our tool. So our first set of codes are for our doctor's office visits. We have new patient codes and established patient codes. And it also gives you a reminder that we must use modifier 25 with these E&M services if a procedure or another service is performed on the same date. We have well visits like our annual physicals, and they're grouped by age as well as the patient type. Is the patient a new patient or an established patient? So when we say established patients, those are going to be our follow-ups. Now they have some procedures that are performed. Like normally we think of a pap smear, we think of our gynecologists, but your family doctor can do a lot of actually procedures that you can also get done in a specialist's office. We have the flu shots, the Welcome to Medicare exam. We have consultation codes. There's other services here. Then we also have our office procedures like our EKGs, our spirometry. We have skin procedures, so we're going to see examples from this category like an incision and drainage. Now they also perform repairs, which we usually cover in our advanced courses. Then we have the medications that we inject. It also has a laboratory, vaccines, and then immunizations and injection codes. Now what I like about this particular Superbill is that it also gives some ICD-10 codes. So that way you can use this as a quick reference rather than getting a book, for example. So let's go and take a look at our CPT coding examples.